Did COVID-19 increase the risk of developing lupus symptoms? The question of whether COVID-19 can increase the risk of developing lupus symptoms is an important one. Systemic lupus erythematosus, commonly known as lupus, is an autoimmune disease where the immune system mistakenly attacks the body's own tissues. Understanding the relationship between COVID-19 and lupus involves looking at how viral infections can affect autoimmune responses. Current scientific evidence shows that patients who already have lupus are at a higher risk for complications from COVID-19. This is due to their immune system being dysregulated and often treated with immunosuppressive medications. However, whether COVID-19 can actually trigger lupus symptoms in individuals who do not have a prior autoimmune disease is still being studied. One key point to consider is that COVID-19 can lead to a strong immune response. Sometimes this immune response can cause excessive inflammation, known as a cytokine storm. In individuals who are predisposed to autoimmune conditions, this immune activation might theoretically trigger symptoms of autoimmune diseases like lupus. There have been some reports of new autoimmune symptoms appearing after COVID-19, but these occurrences are relatively rare and not definitively linked to lupus. For those who are already diagnosed with lupus, COVID-19 can worsen their symptoms or lead to flare-ups, especially in severe cases. The stress that the infection places on the immune system can contribute to this worsening. Additionally, lupus patients have been found to be at a higher risk for complications related to COVID-19, which can further impact their disease activity. It is also important to note that individuals with autoimmune diseases, including lupus, may face greater risks of severe outcomes from COVID-19. This is partly due to their altered immune function and the immunosuppressive therapies they may be undergoing. However, this does not mean that COVID-19 causes lupus. Instead, it highlights the vulnerabilities that lupus patients may face during the pandemic. Research is ongoing to determine if COVID-19 can trigger new autoimmune diseases or lupus symptoms in previously healthy individuals. So far, there is no solid evidence that COVID-19 directly increases the incidence of lupus. The relationship is still being explored, with some early reports suggesting possible links, but they lack large-scale confirmation. Vaccination against COVID-19 is highly recommended for individuals with lupus. Vaccines have been shown to be safe and effective for lupus patients and do not increase the risk of developing lupus or causing flare-ups. In conclusion, while COVID-19 may exacerbate symptoms in those already diagnosed with lupus and could potentially trigger autoimmune responses in rare cases, there is currently no conclusive evidence that COVID-19 significantly increases the risk of developing lupus in the general population. For anyone concerned about lupus symptoms after COVID-19, it is essential to consult a healthcare professional who specializes in autoimmune diseases for personalized evaluation and care.